Hey, well, good morning, everybody, and welcome back to the second day of the Higher Education Summit. Really glad to have you here for this pretty hot topic, obviously, right now. And also just wanted to address the audience that this is, really open to anybody, but the audience this is geared towards is really kind of the operations and administrative side of the house. What are tools, what are resources, and what are others doing right now to ensure that we can get people back on campus and what that can start to look like. So I'm Brian Baldwin, been with Esri for about 7 years, really excited to have this session and have everybody jumping on. Also have Aaron Chevrant from the University of Washington and Diana Henderson. And we'll be having them do bigger introductions and pulling them into the conversation in a little bit. But let's get started. So top of mind for everybody right now is what is it going to look like for campus to return? This was an article that just came from the Chronicle for Higher Education, and there's a number of articles like these that are out right now. And I know, having talked to a number of you and having read, countless articles and looking at what schools are doing around the country and globally, it's a big mix, and everybody is still kind of figuring this out as we go along. The main takeaway, though, from pretty much everything I've seen is that, these college towns, these universities, they want to get students back in some form. And it's that balance of how do we do this safely? How do we have some kind of academic community that we can have exist in person? The behind the scenes, and this article was out on the New York Times about a week ago. Um, you know, Colleges are potentially a hotbed of you know infections, or a hotbed of the ability to kind of spread the coronavirus. And already there's been cases tied to a couple schools spread across the country. And top of mind for administrators and others is going to be how to address this and how to quickly nip these cases before things spread across a campus. And the plans for everybody have been changing dynamically. When I was watching this back in, I know even in May, majority of campuses were looking at coming back in person. And there's been a couple that have even recently just announced they're going to be going fully remote, or a mix of hybrid and remote, and maybe just freshmen back on campus, maybe just sophomores. But the balance has really been different across all of the schools. But there's been a couple commonalities for everybody, and these are just a couple examples of a couple websites from schools. I've got University of Kentucky on the bottom here, University of Minnesota, and a few others, Notre Dame on the bottom as well. And I wanted to just pull out what some of these commonalities are that we're seeing across the landscape. And in terms of all the plans, this is certainly not an authoritative list, but these are kind of the main tenets that we've seen that schools are looking to address. And the big takeaway for me is that almost all of this list can be addressed with, physical and, spatial tools. So all of these things exist in space. So we could help use GIS, we can help use spatial tools to also help enable and manage these plans. So the first one we obviously know is the social and physical distancing. So that 6 feet of separation, and also looking at hallways and corridors and stairwells to how to keep that distancing. Hygiene, this is really just the reinforcement of that. The addition of additional signage, maybe placement of hand sanitizer, hand washing stations, etc., and how to ensure that it becomes a culture of hygiene on the campus. Masking, I think almost 90%, or almost every single school I've seen thus far, has had policies that they've put in place to say that masks are going to be required when you are on campus. Even outdoors, anytime you step foot on campus, you're going to need to be wearing a mask, either for students, for faculty, for everybody on campus potentially. Health screenings. So these have been a mix as well. Are there going to be self-attestations to be able to fill out when you're going to come back on campus to certify that you're not COVID positive, that you haven't been in contact with anyone? Is there going to be actual testing done when campus resumes? Is there going to be a schedule of testing that will take place maybe weekly or monthly for students that have more susceptibility to contact or contract the virus? And then lastly, a workflow I've seen at a couple different schools and also have seen on the local government level is certainly not the flashiest workflow, but effluent testing. So it was shown early on that COVID can be detected in sewage. And so rather than doing testing of every individual, we could start doing testing of individuals at kind of the group or the residence hall level. So if an effluent test comes back positive, we could then do more testing and then, dive into that specific area more specifically. So these are the 5 workflows we're going to be looking at with solutions and kind of talking through. These are really some of those key ones that almost I've seen it at every school that they've been focused on in different ways. So this brings us to our first poll question. And related to all of those factors on campus, have you seen GIS being used to assist with a campus return? And so we'll give you a couple minutes or give you about 30 seconds to log a vote for this. And are we able to bring up the results live, Angie, or no?
Yes, we are. Hang on.
No worries. Wow, so great. Thank you everybody for putting in these results. So it's almost 50% have said, GIS is not being used potentially with that return to campus. And this was something, we addressed in a community meeting back about a month ago, was the fact that, and this will be kind of part of our conversation with Diana and Aaron, that, the GIS, that crowd or that group on campus could almost be forgotten at on times in terms of the resources and the tools they could help bring to address this problem and address the return to campus. So that's really clarifies kind of the situation that we're seeing. So thank you everybody for submitting that poll. So with that, I wanted to introduce Aaron Chevrant from the University of Washington. Aaron has been at UW for over 16 years, and he's currently the CAD GIS system manager for UW. And they have a wonderfully acronym for the group MAPS, which is assets, properties, and systems. Aaron, what's the S?
Spaces.
Spaces. Okay. So we're really excited to have Aaron here, and he's going to kind of talk through a little bit of what he's seen at UW and some of the things that they're using in terms of spatial tools to address and help with the reopening. So I'll turn it over to you, Aaron.
Thanks, Brian. So our story with GIS and COVID planning started a few months ago when we were really flattening the curve and everyone was pretty optimistic about coming back in the fall. And so we wanted to make sure that we had a plan in place to really make sure that everyone was safe doing that. Because the university is pretty large and complex, it's pretty common that administrative tasks are just kind of decentralized. So the efforts for planning for the safe return to campus was distributed amongst the major units around campus. So my group in facilities, that task landed with our planners. So they got to work right away trying to figure out how do we make sure that everyone has enough physical distancing, we've got the supplies we need, and the facilities are set up to support returning to work. So, I guess I didn't have my title slide. So this was an early prototype that they came up with where they could visualize kind of where people might be and how much space they needed, as well as looking at traffic patterns and sanitation stations, things like that. Really great tool. You start out with a PDF floor plan print that we do every day, and they brought it into a graphics application like Illustrator and just started working on the graphics. Again, works well. The problem is that it doesn't scale very well. We've got about 200 floors of just facility staff. So trying to scale this sort of product up to do that becomes really challenging, especially as we start looking at needing to make changes to the facility. Then you have to revise these maps, and there's not a good way to update the background map. It's a very manual process. So they came to us wanting to see if we could support that effort with a GIS type of solution that would be a little more automated. So we started with our space management system, which is a GIS application, and we're currently tracking office assignments for employees as just pure data. So it's an employee ID to room number association, essentially. And we were able to use FME as a way to generate points in the center of those rooms for each of those occupants. In the situation where there's more than one occupant in a room, we want to make sure that those were dispersed out so that people could see those points and easily select them to move them to the real location. Kind of in the bottom right corner on the right side, there's some cubicles, but the people aren't assigned in those cubicles. It's all just one room. So they're just kind of bunched up in the center. Once we had the points in GIS, we were able to do an InVision Web App for the planners so they can go in and move those points around as people. So the green points represent the people that are assigned to a space in our space management system, and their point is actually in the same room that they're assigned to. This being a planning app, it's not going to automatically update an employee's location when you move the point around. So this gives them a lot of flexibility to try some different things, see what it would look like. And when you end up moving one of the green points for an employee to a different office, it automatically detects that it's not in the right location and will highlight it as red, which then tells them, okay, if this is what we really want to do, you'll need to go back and update the official space inventory so that they're assigned to the right location. We also have the yellow points, which represent non-employee points, where things like conference rooms, you start doing some capacity planning for conference rooms and other non-office spaces. And just like their prototype app, being able to do the hallways and sanitation locations. We also have the ability to use a measurement tool within the web app so they can measure the hallways to see, is there enough distance to do a two-way hallway, or does it need to be a one-way hallway? So it gives them a lot of flexibility with that. Once they have that done, we have some custom printing tools so they can create, this is an example print that we have where this can be sent out digitally to all the occupants before they come back to the office, so they know what the new layout's going to look like, what the restrictions are, where the sanitation stations are, where the cleaning supplies are, things like that. These can also be posted in the building, so if you have visitors coming to the building, like for a conference room, they'll know kind of what the capacity of that room is and limitations as well. We're also looking at doing some other printed templates for really more the operations side for the facilities field crew when they have to go out and install the sanitation stations, or if they're going to do markings on the floor with tape or wherever that might be to know where the one-way hallways are. This can really give them a plan for what needs to be done. But at the same time, we can also use all of this data on the back end to say, well, how many sanitation stations do we need to order? Because we can do it all digitally and plan it all out and then put together a bulk order. So where we're at right now, we're getting ready to release the app for the facilities department specifically next week. We've had a lot of really great feedback. A lot of people really like it. It's actually kind of leaked out a little more than we had planned, but that's not too bad. One of the issues that we did run into was there's a lot more need for more detail for furniture than what we currently have. That's where things get really, really specific, trying to figure out, okay, what kind of separation is there between these two people, and is that enough, or do we need to install plexiglass shields and things like that? And of course, once we get that in place, we'll start working with other groups around campus that are interested, like our classroom group. They actually have a couple different layout options for some of the classrooms, so being able to support that in an interactive way. But also the other schools and colleges, they actually have other needs beyond what we've seen for our facilities group. So we'll have to start up a new project and figure out how we're going to support those as well. And that's about it.
Awesome. Yeah, and Aaron and us kind of talking about this, I think one of the things that was really interesting to me, and it kind of goes to even the poll question, you said this kind of leaked out more than you guys wanted wanted it to in a sense. And there were starting to get requests from other schools and other departments, right, for something similar.
Yeah.
Yeah.
Yeah, right now we are able to support that in a limited fashion where our planners and facilities can work with the other schools and colleges, and our planners would actually do the maps for them for right now until we can really figure out how to make that work across campus.
Very cool. Well, Aaron, thank you so much for sharing a little bit of what you guys have been doing and kind of what you're in the middle of right now. Really appreciate it. We'll have kind of some open Q&A at the end. So if people have questions for Aaron or specifically on what UW is doing, please, put them into the chat or wait until the end, and we'll kind of jump to the questions at that point. So next up, wanted to introduce Diana Henderson from UCSD. So Diana has been at UCSD for over a year now, and she's working as the campus space analyst. She's been working with Esri tools and resources for a bit. She's been helping recently get her campus and get their facilities into the community mapping program. So I've been working through that to have kind of that dynamic way to update that information. But really excited to have Diana here. How you doing, Diana?
I'm doing well, Brian. How are you doing?
Doing pretty good. We're going to do this as kind of a Q&A, a little kind of interview style to, understand what UCSD is going through and what Diana's been helping with on the campus. So Diana, I guess the first question for me, and, when I've been talking to anybody, at a campus right now, it's been, what do you see as the biggest challenge to coming back on campus?
Well, I think that they're really, the biggest challenges, of course, are this insurmountable amount of cleaning and determination of social distancing within buildings, and as well providing that information out to people in a timely manner. I think that's just kind of a huge workflow that needs to be undertaken.
Yeah. And with that, I mean, with all of us obviously on the GIS side and with this conference, Esri conference, GIS, what are some of the ways that you think GIS could potentially assist with the return, or what are some of the things that you're looking at or you guys are doing?
Yeah, well, we, of course, things have seemingly moved very quickly in this environment, and we've now kind of built a workflow in terms of field work to researcher, and then even dissemination of data out to the public or in a university community audience. And so we really see this opportunity presented itself in terms of using GIS. Unlike Aaron, who has like a very mature GIS environment, we're in the infant stages at UC San Diego.
I think that's great. And I think, I've talked to people on both sides of the house. It's, everybody's not in Aaron's shoes and has, 16 years of having every indoor piece of furniture mapped and everything, in the GIS and in the facility system. It's on a wide range. The one thing I think has been really interesting, Diana, that, we've talked about a couple times is, and it goes to even what we said with Aaron and kind of that other question is, has this helped kind of broaden the audience that's seen what GIS is or what it can do on campus?
Yeah, absolutely. I have been working for a year. When I first came on board, it was, hey, you did GIS one day in your career, and then why don't you stand up a program here? And which is a daunting task to be given, immediately after hire. And so what I've been doing is building relationships, demonstrating tools, and really when we talk about COVID-19 and getting people back to school, and effluent testing, this just culminated in this project that potentially will have high visibility and really demonstrate to people what GIS can provide to them.
Awesome. Yeah, I mean, I think, even going back to the user conference we had a panel where there were a lot of sessions and questions of people asking, how how do I show administrators or how do I show directors, you know, the value that GIS can have? And, you know, it's always terrible to have, you know, something of this magnitude and terrible happen, but there's obviously opportunity here to use that to show the value that it can have and kind of raise the visibility of GIS.
Yeah, I certainly am using it as a tool to provide to leadership, as well as, for me, this is a great way to see the underground utility model and push that data into the modern age, because it has been piecemeal. The data isn't built in such a way that we can actually model it. Lines are not going in direction of flow, that type of thing.
Yeah.
And so this is really a great opportunity to like dig into the data, provide information as much as we can. And with this solution that provides the researchers this linked data throughout the whole process that is going to, I think, improve efficiencies and make this testing way more effective and timely.
Awesome. Well, Diana, thank you so much. Really great to have you on. And same thing, you know, Diana will be here, and for the Q&A, you know, if you have questions or anything else for Diana or Aaron, please enter them into the chat.
Thanks,
Thanks so
Brian.
much, Diana. So the next couple of things we're going to look at is, you know, we'll show an example of that Effluent solution that Diana was talking about that, you know, they're looking at deploying at UCSD potentially. We'll also look at some tools that are similar to those that Aaron presented. And also, I just want to make sure people are aware of the resources that are out there from Esri. So Esri has a COVID-19 you know, landing page, which you can get to. And through that landing page, there's a lot of different resources. Almost can be a little overwhelming in terms of the amount of resources that are there. There's blogs, there's white papers, there's solutions, which we'll kind of be talking about next. And you can see on this slide, the font's a little bit small, but it says a coronavirus wellness check, and that is an ArcGIS solution. There's a small business recovery ArcGIS solution. And so that leads me into the next question I'm curious about is, for those out there, have any of you used or deployed any of the ArcGIS solutions templates? And if you don't even know what this is, then it's probably the unsure. So I'll give about 30 seconds for you to fill this out. Look at that. All right, so we've got a couple of you who have deployed them, 20%. Same number, about 20% unsure, which is fine. I'll kind of lump that into the no category. And no, about 63%. So this is good. Just to, you know, I have slides set up to let you know what it is and kind of show you what's available. So if 100% was yes, then this would have been a pretty boring presentation for everybody. So what are the ArcGIS solutions templates? So this will be kind of one of the actions or the asks of you, you know, after this session as well, is to just Google ArcGIS solutions. And here I have a couple examples of the domains that we've released solutions for. And this could be one of the reasons that folks in higher education haven't, you know, looked at these. Is, to be honest, we don't have a landing page specific to higher ed. But I think the most important thing to note is that if you think of, you know, the term we've heard recently is a smart campus, or that a university is a small city, and the domains, the workflows, the solutions that are available in all these other, if it's utilities and telecoms or emergency management, or here you can see local and state government, so many of these can easily apply to a campus setting. And what they are is it's literally just a click and deploy to be able to get a template for you onto your organization site, your portal, or ArcGIS Online. Or it could be something in ArcGIS Pro or a template to show you how to do a workflow. And you can see here there's over 450 of them, and they cover a wide range of different work and workflows that cover a lot of different things that happen, in the campus community. So I definitely ask you, go take a look. And the following kind of demonstrations and solutions we'll be looking at are available on these sites. And so the first one of those that we're going to take a look at, and you can see the asterisks here, and the caveat is this is actually getting released in the next week. So if you go to that ArcGIS solution site, you won't see this yet today, but if you go in the next week, I believe it's on the 11th that this is getting released. So at that point, everything that I will show you in the demonstration, you can just hit one button to deploy it and then go grab and see all of these resources and adapt it for your campus. So what does it let you do? So what it does is it lets you build and manage facility health plans. So it's for that kind of initial placement of items, or as you can see here in the screenshot, where are bathrooms? Where are we going to put sanitizer locations? And if you have some of this information in your facility management system already, it could just be moved over and you don't have to digitize those things. But for those things that might be signage or a temporary, hand washing station, all of that stuff could be digitized. So that's what I'm saying here, this plan health resource locations. You can manage, monitor them. We also have capacity estimation tools. We've probably seen this, or many people have seen this, I know I have, at the supermarket. Somebody standing outside with a phone, or a pad of paper, just kind of really, how is this going to be managed? How will it be tracked? And how will we start to understand there are actions that might take place? So with that, let's jump to the demonstration for this solution. So when you click deploy on the site safety solution, the first thing that it will give you is a dashboard to let you understand really what's going on and let you start to see this kind of broader picture that I mentioned on campus. And we're going to kind of walk through each of these workflows and show you what this kind of means and what you could do for this. So the first workflow is this issue reports. And so if I'm looking at my campus, I can see a couple of these reports that got logged. I've got one here that's a request for cleaning, and I've got another one that's a face mask compliance problem. And so I can go and update the status of these. So a manager, or if it's emergency operations or emergency management or facilities, whoever needs to kind of manage this plan can actually come in here and see in real time as these changes take place. So I'm going to go and now issue one of these issue reports. And let's say there's a group of students sitting outside the library, and someone, a student or faculty or staff, whoever we want to enable with the application, kind of reported a violation. So this could be available on the phone. This could be, submitted by the web. So I'm going to say there's a face mask compliance issue, kind of middle range issue. I'm going to say group of students outside the library. And again, this might not be related to capturing these things to address them right at that time, but you could start to see patterns and trends related to issues across the campus over time. So I'm just going to click on the map here to grab a location, say library. Could actually include a floor if I wanted to, an image, and submit. And I'll probably say it 5,000 times, but all of these solutions, all of these templates are completely configurable. So if you wanted to enable it so that that survey is open to the public and all students can just see it, and photos are not part of it, it's certainly something you could enable. If you want it to just be for staff and or faculty, that's something you could do as well to tie it to a named user. So you can see there, we got our new point, we've got a new report, so that face mask issue on campus. And I also have a log here so I can go back and look at the historical issues as these ones have been closed out. The next workflow is this capacity monitoring. So this is the one I mentioned of, tracking in real time what the capacity is of some of these rooms. So I'm going to come over here to this library building in this spot, and I'm going to click on the library. And it highlighted this space that I defined. You can see it currently has 59 staff or students in it with a max that I set of 145. So it's telling me I'm at 40% capacity for that spot. So I'm going to go over to my phone and show an application that we put together through Quick Capture. So you can see down below, I've got area name library, and that's just a simple filter to be able to filter those spaces. And as I click the enter or exit buttons, it's just sending a count back to that feature service to update this in real time so that we have a count of how many staff or faculty or students are currently in that space. I click back on my library and come back to my room. So you can see now we're up to 63. So we have those additional staff, those additional students who went in here, and we can start to manage this at either a room level or a building level. And you could certainly tie this kind of a dashboard into your key card system. You could tie this into another real-time system for managing this across campus. Or you could start with a lightweight tool like this for certain buildings if it's cafes or student unions. Again, it can run the full workflow for how in-depth you want to go for this kind of a solution or deployment. The last workflow here is the cleaning and restocking. And so you can see we have a bunch of different spots around the campus that we've noted that include high touch locations. So this is an elevator bay or a bank. We've got entries, we've got exits. And in my cleaning and restocking, all of these points, you can see this entry was cleaned and right now it's overdue. So it hasn't been cleaned in 60 minutes. And again, this can be changed, configured based on the types of locations, based on the schedule that you would want to maintain for different categories of spots. If you have an elevator bay and you want to make sure that it's cleaned every 2 hours, you can set that kind of a filter and now watch in real time as these places are managed and ensure that they're getting cleaned. Or you could start to see at a building level, those spots that aren't getting managed. So let's jump back over to the phone. And I'm going to go into collector. So we wanted to make this as easy as possible to update and manage. And so I have those same points inside of a collector map, the signage, these high touch locations, and you could limit this to just a few locations that you want to ensure you're tracking for either cleaning or restocking. I'm going to click on that entry, which is on floor 1, and you can see it has a related table tied to it. So all someone would need to do on the facilities side or in the janitorial services is click that related record and just hit add. And instead of changing a status or updating any details, I'm just going to hit submit. And so all that's doing is now letting me know that that spot has been touched, has been cleaned, and now we'll then take it off of our list and ensure that we don't have to manage that spot anymore. So how do we get all of these things set up? So this is the application where you can come in and do the design of this site safety plan. And it's just a simple web app builder application. So as I zoom in here, we've got a palette of feature services and features of its points and polygons that a user could come in and start to edit and provide into this plan. You can see I have building footprints, which I ended up just pulling over from my building management system. I didn't want to come in and hand digitize those. Similarly, you could do that with bathrooms. You could do that with other features. But here, let me zoom into my library. And I'm going to add on a new hand sanitizer station. So I'm just going to click, I'm going to click on the map to drop it in. I could put in a description. I can put in a floor number. I'm going to put this on floor 2, and I'm going to hit save. So now that hand sanitizer location could be something that could be tracked to see when it is cleaned. Is it restocked, every day? How often is that thing getting depleted? And we could use the collector application to manage it and make sure that people are going there and visiting it. And if I scroll down here, you can see the other list of values that we provide from restrooms, et cetera. And again, if there's additional things missing here, you can add in whatever you want to. Health lines. See, the ability is, even Aaron showed in his application, what are the routes of ingress, egress? What is the flow of traffic that we would like to have? For each of these buildings or specific rooms, this is an interesting one. So you can see here, I've got this one room defined that says it's 1,600 square feet, and it's big enough to allow 15 people in that space. So what we're doing here is having some simple math just within the polygon itself, so that when I create this polygon, and let's give it a name, call it Baldwin. We'll give it a capacity of 50, and I'm going to say it's on floor number 3, and hit save. So it actually came in here and looked at the square footage of that space and set it for me based on what that square footage is. And so I had initially set it at 50, but now based on the calculation of that square footage, I could come in and throttle that max capacity down if I wanted to as well. And again, these are for just those simple tools that you could use on the fly to start to do some of that initial planning. And so we walk through with the site safety at least those 3 workflows. So issue reports using Survey 123, the capacity monitoring using a quick capture application that has a configuration that'll come with it, and the cleaning and restocking. And that's using just a simple map and collector with then related records to be able to tie to those to show how you can manage these and how you could update those. And again, this will be out on the 11th. So in less than a week, this will be available for download. Hit one button and it'll deploy all these maps, all these templates, and then you can start to come in and configure it. So that was the site safety. A much simpler solution, and this one again will be out on the 11th, is one called health screening. And so this is one that has been a common workflow, and one that we mentioned at the beginning of the call, is what is it going to look like in terms of having self-attestations or having students fill out forms or just certifying that they don't have symptoms. And so the way that we've set this up is to allow you to do it for employees and visitors, to let you do the screenings before people come on campus, to be able to then monitor those screenings and then also track it historically. And this configuration also has the ability to enter in when someone comes to check in, maybe at a desk or at the library or student union. You could do a temperature check as well as a second tier check. So let's look at that solution and look at the configuration for it. And so similar to the site safety, one of the first things that we want to look at is a dashboard to let us see kind of what is going on in terms of who has checked in, who has done the attestations. If I click on the far left-hand side, I've got a filter that I can do by locations and do by date as well. So I'm going to filter it and pick a date that was, I believe, on the 5th. I was kind of running some tests and filling this out. So you can see we've got Rena, James Madison, very presidential lineup of students and faculty that have been checking into the campus. And they each check in. And then I have the ability as well to then click on this staff. This will bring me to another survey. And I then have the ability, you can see the name is filled out, to then enter in a temperature. So this dashboard could be used at a central table, at a central check-in, to then further verify that someone is okay, that they don't have a temperature exceeding what the policy might be. And the other one is just this simple survey to come in and do the health screening itself. So let's say I am staff, I work out of building O, let's say my name is Brian James, put in my email. And I'm going to say that, yes, I have in fact tested positive for COVID. So I hit yes. We've just put in here a simple video that's pushed out from the CDC. If I'd selected no, I would have some other questions that I would have to come in and answer. Do I have any symptoms? No. Have I been in contact with anyone with symptoms? No. Certify and then a signature. So I'm going to actually come in here and say, yes, I have tested positive, and hit submit. So that information would then be pushed back to that dashboard. And if I go over to this dashboard again and look at those records that have failed, I can see now that we've got failures from a couple different people, and then I can do the same thing and filter that for the day to be able to see who is actually not able to come onto campus and who has failed. So you can see here that survey that I just filled out, or the one right here. So Brian James at 11:42. And the other thing, hopefully it got sent. There it comes right now. So you can also hook this up with Microsoft's Power Automate. So what I did here is I grabbed that survey, and if someone was COVID positive, if they checked yes, it would then send an email to whoever I want to enter in, and it could fire that off and have that fully automated. So now the health department, my manager, whoever else, they could then get that report immediately as soon as I fill out that attestation. So those kinds of things can be built out and scripted really, really easily. It's a simple configuration to get that kind of automation in place. So that is the health screening solutions. We've looked at two so far, the site safety and the health screening. One that I don't have a demonstration for, but we'll just talk through, is the community contact tracing. And this is more of a configuration. And we provide the tools, the toolboxes for you to run through and do this. So we all probably know what contact tracing is. It's, looking at and seeing who somebody has been in touch with, that they've come into physical contact with or shared a space with that's maybe tested positive. And then using that kind of a paper trail to figure out who else might be positive and to start quarantining people. The community side of this is starting to understand how location comes into play. And so in the video here, all we're showing is the ways that you could take your traditional contact tracing information, locations of individuals, where they live, where they have been, and start to map that information to understand those relationships in space. And so here we're zooming in to see some hotspots of where people have been in the community. And not only can we start to map this information, but we can also start to show this information in different ways. One of the really powerful ways to display this is with link charts. And so here, all of these red dots are those individuals that have tested positive. And now we're looking at the relationship of these individuals to others that have tested positive. And so here, in the traditional contact tracing sense, you can see this Willard tested positive and potentially, spread the virus to Colleen here, who then in turn spread it to Carlos. So you can see in the contact tracing world, this would make sense. That individual spread it to the next one. When it starts to get to the community level, you can see here in our other link chart, we've got Michelle, who has tested positive, but there's no one in that circle of people she has been in touch with that potentially gave it to her. So for that, it makes sense to start bringing in locations that are in the community. Where did Michelle go? What are some of the common stores or places that she has frequented that might be one of those hotspots? So here's a list of addresses of, businesses. This could be dorms. This could be residence halls, anything on campus that we could then map, take the contact tracing information, and then start to build out relationships between, who is positive and where some of those, hot spots on campus or in the community are that could be some of those locations that are really the super spreader locations or events. So in this chart, you're seeing here this positive individual visited, these 9 or 10 locations. This positive individual did the same. And the blue are those locations. And so this location in the middle here is the one that has that commonality between all of those people. And so that's potentially that spot. Maybe it's, you know, a really frequented bar on campus. Maybe it's a restaurant that hasn't really implemented, you know, masking, et cetera. It'd be a way to start seeing and understanding where some of those spreading locations are by using geography and using GIS to help with this. So again, this is a configuration. There's a number of the tools and resources out there as videos. If you're interested in looking at deploying something like this, just reach out and let us know, and we can kind of show you what there is and talk you through it. The next thing I wanted to mention and talk through is ArcGIS Indoors. So GIS traditionally has always been, you know, the outdoor environment typically, except for in Aaron's case, who's been doing indoor GIS for 20 plus years now. For those that, you know, haven't had, you know, that ability to have kind of their spaces indoor mapped for that long, you know, we put out recently a product, ArcGIS Indoors, to start getting your data mapped in the GIS at an internal level. So to do, you know, web application viewing of it, mobile applications, and then start to integrate that information with work orders, with incidents, to have this kind of truly holistic system to see what is happening around campus and what's happening at the facility management level. And how does this relate to COVID? So for the different levels of ArcGIS Indoors, you get higher grained levels of information to let you see kind of more clearly on campus what might be taking place. At that level 1, you can see building occupancy and outdoor movement. Level 2, you can start to do some of those room assignments like Aaron was doing with his InVision application, and space utilization. Also this ability to do flexible seating, or, you know, a term that's come up called hoteling, to be able to have just offices or desks that are just open that people can grab and just assign for themselves. And at level 3, can you start to bring in real-time information and alerts and notifications, and also track and monitor indoor and outdoor movement. And then the last demonstration we want to run through, I know we're throwing a lot of information at people, is the one that Diana spoke to on the effluent testing. And so this is a configuration to show you how you could start to actually manage this workflow spatially. So the samples taken at sewer locations, relate those test sites to test tube samples, also the ability to submit lab results, and then view these test sites spatially and view where those locations are. Oh, I'm gonna have to log back in. Let's see which one I've got to get on. All right. Got timed out of my applications, but that's okay. So I'm going to log back into this dashboard. While we're at it, I'll also log back into the survey. So what I can see in this dashboard is where my sewer information is. So I've got my underlying sewer data. And then we also have information related to the testing that has taken place at the sewer sites. So we've got one SARS-CoV-2 positive test. I can click here and zoom right to that location to see what manhole gave me that positive test. You can also see here how many total samples have we pulled, which ones are pending having a lab run for them or a lab result, which ones are potentially delayed. And I have just a simple query set up here to say, if it hasn't had a result entered in more than 48 hours, then that's an issue, and we need to make sure that we're getting those results pushed in here. So here's all the samples and all the lab results, and then also the sample results or the sample details. And so for this one, we also want to go out to the field to take a look at how we could start to manage this on the phone. So I'm going to go to Explorer, and I've got the same view of my manholes here in the map. And what I want to do is now just come in and enter in, you know, I'm going out and doing a draw at this manhole to do a test. And so I'm going to go to this EU 262. And then I've got a link inside of my pop-up. So the field person, all they have to do is click this link to say that they're doing a manhole survey. You see it's got a date time stamp just locked in. It pulled over that manhole ID, so I have it related now back to that record. I also have the ability to do a barcode. So I'm going to grab the barcode from my test tube so I can relate it back to that actual tube. So it pulled over my barcode, and I'm going to put in a signature so we know who did this in the field. I could attach a photo, which is actually required, so I'll just grab one on my desk. And I'm going to submit this. So now what we've done is we know that we've pulled, this survey in the field. We've done a test. We don't have any results for this yet in the lab. I can see this now on my dashboard. We've got total samples 5. We've got 2 that are pending lab tests. So the next step of this workflow is to actually jump into an application and allow the lab to then provide updates that are coming in. So I'm going to refresh my data here. And I've got this sorted based on when lab results have been pulled. And so I can click right on this record, and I can go right to this spot in this location and then enter in my results for it. So you can see up here, it's highlighted on the map. And I'm just going to grab that result. And then instead of allowing the lab to actually come in here and edit the sample tube or any other information, we can lock all those fields. And all I want them to do is edit and enter in the value for the result of this test. And so this is the RNA test that lets me know that that sewage was COVID positive. I'm going to hit save. And now you can see this point turned red. So we know this was a positive lab result. And if I come back to the dashboard, we've got 2 COVID-2 positive results. And we know exactly what manholes those took place at. And I have the ability to then start to try to understand and relate those to the residence halls or to the buildings on campus that are then having those positive results. And so that is a configuration right now. If you're interested in that or want to see how that could be done, again, just reach out and let us know, and we can help you with getting the configuration of it up and running. So in terms of what campuses are looking to do when they come back in the fall, this is what we mentioned at the beginning of the call. This is kind of what we've seen as the 5 standard workflows from the physical distancing, hygiene, masking, health screenings, and the effluent testing. And so really the goal that I wanted to set, for this was letting you hear from your peers what they're doing, and then also understanding that it's not too late to get some of these things deployed to help with the reopening in the fall or even going into next spring. Some of these solutions can just be clicked and deployed and start to be configured. These things don't take months to stand up. And it goes from that full range of, you can start to integrate your own, facility management systems into the GIS, or you can just open up, that web app builder application and hand sketch stuff in. It can go, there's a wide range of ways that these things can be deployed. And so we looked at site safety, the health screening application, community contact tracing, looked at indoors, as well as the effluent testing. So if there's questions on any of those, we'll have some surveys at the end. Please just let us know and we can reach out with any of those. So for the next steps, we have a COVID-19 resources page that has case studies, solutions, white papers. The one that I mentioned in the beginning, the Esri one, I ask you to go just take a look at that and see what might be applicable. The ArcGIS solutions site, looks like a number of folks haven't deployed them or haven't looked at it. It's a really worthwhile place to go and see what kind of configurations exist. And even on the academic side, it's a great way to see what people are doing and what they're deploying in a range of industries on the private side. Return to campus resources. So we put out a blog post on GeoNet that lists out a lot of the resources available that I've just gone through on this call with links and ways to actually get to things. And I'll show you a screenshot of how to get to that in a second. We have a webinar series coming up this fall. I'll show the dates to that. This is just to let everybody be aware of it. And also the ability to connect with your account manager. We'll have a slide in a second. So if you need to reach out to someone, if you have questions, please fill out a survey and connect. So how can we help? If you are looking to get in touch with your account manager, if you have questions, if you need to send me an email, or if you have questions about any of these solutions, scan your phone, take a picture of this, and or go to this URL, or just take a screenshot right now and get to it. And you can fill out the survey later. Just asking some simple questions for basically how can we help you out. And as it says here, we'll get in touch with you as soon as we can. So take a screenshot. I'm going to jump to the next slide, or fill it out yourselves right now. So the resources page, if you go to GeoNet, and if you just search for returning to campus safely, you can see here it came out on June 22nd. I just updated it 2 or 3 days ago with the most recent information and some links. So just Google that or search for it in GeoNet. It'll pop up, and it's got all of the resources and everything related to COVID right inside of that blog post if you need to look and get to anything. So the webinar series coming up in the fall. We'll send information out about this later. If you're interested in getting the emails or information about it, you could put that in that kind of contact me post or the more information. So there'll be kind of getting started, your spatial foundation, bringing GIS indoors, mobile, so getting a mobile workforce, and then also kind of looking at utilities. And again, this is the angle of this is for kind of operations and the administrative side of campus. And then lastly, please share your feedback of the session. So this is a survey that you can say if this met the mark, if there's things missing, or if you'd like to see something else. This is how we get content to you. This is how we start to get sessions together for these conferences. So would love to get everybody's feedback. And with that, we'll finally take some questions from the audience. I know we've got a couple minutes left. We can probably go maybe a few minutes over. So thank you to Aaron. Thank you to Diana. We'll open it up to Q&A from anybody if there's anything.
All right. Yep. So we did have a couple questions, and the first one, Brian, could you just confirm the availability of the coronavirus site safety template? Is that August 11th, and it'll be on the solutions.arcgis.com site?
Correct. The most recent date I've heard is August 11th. So yes, if you just wait for that date, it'll be pushed out on the solutions site, and you can go download it at that point.
Fantastic. So here's a question for Aaron. If you don't mind my asking, how many support staff do you have for this GIS team? So that would include technicians, analysts, developers, and management.
Unfortunately, that's a pretty difficult question to answer these days. We actually just went through a pretty significant reorganization. As Brian was saying, we used to be called the MAPS team, so mapping assets, properties, and spaces. At that point, we were a pretty consolidated team focusing on just this. At that time, we had, I think, 9 or 10, but due to budget cuts and we had some layoffs and then the restructuring, there's kind of 3 core GIS full-time staff. We have the floor plans being updated as part of our engineering drafting group now. So there's currently only 1 person doing that. Usually we have 2 or up to 3, depending on what's going on, maybe having interns, things like that. And then as far as management, we have a director, but that's pretty much it.
Okay, so not a huge team by any stretch.
We also have some other people doing more analysis on the space data, so reporting and things like that. So not really focused just on the GIS infrastructure side. So.
Got it. Yep. So let's just do one more quick question. So Brian, the comment that health screening and contact tracing are interesting applications. Do we know of any implementations? Are there any concerns about privacy? So can you maybe speak to the design of these solutions and what steps have been taken regarding privacy?
No, great question, Angie. So that was probably the first question that was kind of part of that implementation for the health screening one, especially, is ensuring that there was no, PII information tied to, feature classes. And one of the things that is interesting actually is, and this is just a small example, is that the way that the temperature information and the name are captured, that it's actually pushed to a related record. And so we're not kind of even capturing the temperature with that person's name. And so those kinds of things are being used to, obfuscate and make sure that there's not going to be an issue in terms of, capturing information together that could be kind of sensitive and health related.
Fantastic. Thanks for that. All right. Well, thank you all for joining us. Thank you, panel, for the great information.